Dr. Raymond Turpin. I'm the Executive Director and the Clinical Director of the Pearl Psychedelic Institute, a nonprofit located here in Western North Carolina, and our mission is to try to help shepherd psychedelic-assisted therapies into mainstream acceptance and mainstream use. I'm here today to talk about MDMA Assisted Therapy for Post-Traumatic Stress Disorder, or PTSD. MDMA's official name is 3,4-methylene dioxymethamphetamine. It was first invented in December 1912 by a German chemist named Dr. Anton Kolisch, who was working for Merck Pharmaceuticals, and the patent was awarded in 1914 under the name hydrostenine. It was then put up on the shelf and essentially forgotten until 1976, when it was believed that Dr. Alexander Sasha Shulgin for the first time resynthesized it, and he tried it on himself with a very small dose, working his way up until he got to 81 milligrams in September of that year, and he felt the full effects of MDMA. And he had the insight at that point that it could possibly be a valuable adjunct to psychotherapy. So he contacted his friend Dr. Leo Zeff, who was a psychologist living in Oakland, California, who was on the verge of retirement. And he tried MDMA, and this inspired him to want to spend the rest of his career training therapists and treating patients using MDMA and other psychedelic compounds. And he did this until his death in 1988. By the late 70s and the early 80s, therapists were using MDMA as an adjunct in their practices and were finding that it was unusually effective for treating the effects of trauma, particularly PTSD. They also found that it was very effective in couples counseling and interpersonal communication issues. By 1984, some of the first what they called proto-raves were starting to happen on the island of Ibiza off the coast of Spain. And so it began to get into the newspapers that this new recreational drug, which was MDMA, but by that time was going by the name ecstasy, was being used at these and began to get the attention of the United States government. And the DEA made an announcement by the end of 1984 that they intended to place ecstasy in Schedule I, which means it has no medical value and it has a high abuse potential. The therapists and the psychiatrists that had been using MDMA in their practices up to that point demanded a hearing, and there were 4 hearings in the United States where they presented very passionately the work that they'd been doing with MDMA and were asking the DEA to please not make it Schedule I so that it could still be used for research, and with a prescription it could still be used to treat patients. After hearing all the testimony, the DEA judge, Francis Young, decided to place MDMA in Schedule III because he did see the medical value in having MDMA available by prescription. In an unprecedented move several months later, the DEA director, John Lawn, stepped in, overruled his own judge, and decided that MDMA was going to be permanently placed in Schedule I, which is where we are today. Schedule I, again, meaning that it has no recognized medical use and that it has a high abuse potential. With the move to place MDMA in Schedule I, that effectively shut down all legitimate research and made it illegal for therapists to use MDMA in their practices to treat their patients. So what is MDMA Assisted Therapy? In its current accepted protocol, MDMA therapy consists of 3 MDMA assisted therapy sessions. These are scheduled about a month apart, and each session lasts between 6 and 8 hours long. These MDMA assisted sessions are embedded within 12 90-minute non-drug talk therapy sessions. The first 3 talk therapy sessions are preparation sessions, and this is where we are trying to establish some rapport with the patient, establish a sense of safety and trust with the patient. We also want to be able to understand their trauma history, their life story, so that we have some context for the trauma that we're likely to be working on. We also want to prepare the patient for the effects of the MDMA and how to work effectively with the effects of the MDMA. So following each MDMA assisted therapy session is what we call integration sessions, and this is where we are helping the patient review what came up in their previous MDMA session and helping them understand what's coming up and what changes are possibly being presented to them in the ways that they view their trauma and themselves. And these sessions basically are helping the patient continue to learn how to bring these changes into their everyday life. In this current protocol, the treatment team has been consisting of 2 licensed therapists who have been specially trained by Lykos Therapeutics in this specific modality of MDMA-assisted therapy. The research that was previously undertaken using this protocol of 3 MDMA sessions embedded in 12 non-drug talk therapy sessions looked at treating up to 300 people that had severe PTSD, many of them chronic treatment-resistant PTSD. And so out of those 300 people that that they ended up treating, they had an average of 16 years of suffering with PTSD. And by the time they had gotten done with the protocol of 3 MDMA assisted therapy sessions and 12 non-drug talk therapy sessions, around 65% of these patients no longer qualified for a DSM-5 diagnosis of PTSD. There was only one small long-term follow-up study that looked at a cohort from the beginning of phase 2 and followed these folks 4 to 7 years out. And generally those studies showed that these results do tend to hold up over time. So who would benefit from MDMA assisted therapy? There are currently 13 million Americans in the United States that are suffering from PTSD. And these are usually just the people that are actually seeking treatment for it, so the number's likely much higher. We also have 22 United States military veterans committing suicide on a daily basis. Most of that is due to their inability to deal with their PTSD in an effective way. We also have millions of Americans who are non-veterans who are suffering from childhood sexual and physical abuse, suffering from the effects of domestic violence, accidents, natural disasters, community violence. And one of the problems is that our conventional treatments for PTSD are not all that effective. It's believed that about 50% of people find effective treatment for their PTSD. So there's a need for something to be more effective. I've been a psychologist now for over 20 years, and I've been in mental health since the late 80s. And one of the things that I've realized is probably 90% of any mental health diagnosis that I've ever treated or clinically supervised, you trace the beginning or the etiology of that problem, and it inevitably goes back to some poorly integrated traumatic experiences. So we're desperate to try to find a treatment that is effective for treating the effects of trauma and PTSD. One of the problems that we have in this country and around the world is what we call the intergenerational transmission of trauma, where it's passed down generation after generation. And this is a problem that we desperately need a new treatment in order to be able to try to affect some change. So why does MDMA assisted therapy seem to be so effective for treating the effects of trauma and PTSD? One of the problems that happens in conventional talk therapy is when a patient starts to get to the point where they're going to talk about their trauma material, they tend to go into fight or flight or freeze mode, which is an involuntary reaction once they start to get close to the trauma material. And that makes conventional treatment very difficult. The patient has a hard time being able to stand there and be with the trauma material as they're working through it. One of the things that MDMA does in the brain is that it shuts down the amygdala roughly about 95%. And when that happens, that allows trauma material to surface, and the patient is in what we call an optimal arousal zone where they can actually do the work. In normal sensory processing in the brain, what's happening is that the brain is receiving information from our 5 senses, and it goes to this egg-shaped structure in the middle of the brain called the thalamus. It's like the cook in the kitchen that's organizing all the information coming in from our 5 senses that lets us know where we are in time and space. The next thing that happens is this information goes to the amygdala to check and see if there's any type of threat in the environment that we need to respond to. If there's no threat detected, then this information is allowed to go to the higher order processing up in the prefrontal cortex. And this is where what we're experiencing becomes categorized. Where have we been in situations like this before? How do we understand what's happening to us? Another thing that happens is language is assigned to what's happening, because we know that if a memory is going to be encoded for long-term storage and retrieval, it needs to be encoded in language. After this higher order processing takes place, the information then goes back down to the thalamus for further organization, and then through the hippocampus for further organization, before a normal memory is stored in long-term up in the frontal lobes where it can be retrieved voluntarily as needed. What happens in trauma is where this information again is coming in through the 5 senses, and then the amygdala picks up on a sufficient enough threat in the environment to where the brain goes from what we call learning mode to survival mode. And all that higher order processing goes offline. And then what we do is we end up reverting to our more primitive parts of our brain. So it's the most basic processing is what's happening in our brain. And so what ends up happening is all this highly charged, fragmented material ends up being improperly stored in the brain, typically in the hippocampus. And this is where PTSD sufferers are having issues with intrusive memories, nightmares, in more severe cases, flashbacks. And so when MDMA becomes effective in the brain, and the amygdala gets shut down 95%. That allows all this highly charged, fragmented trauma material to surface. And because the amygdala are about shut down, it allows the patient to not automatically go into a fight or flight or freeze mode. So the patient can be with the trauma material finally as it emerges into consciousness. The other thing that's happening with MDMA is it is hyperactivating the prefrontal cortex. So all that categorization and understanding, the language assignment, all those higher order processes that should have happened at the time of the trauma if you weren't in survival mode are allowed to finally happen. There's also enhanced release of two hormones, oxytocin and prolactin, and these hormones allow the patient to feel compassion, empathy, deep relaxation, and this is believed to aid in the healing process of PTSD as well as to aid in the therapeutic relationship with the treatment team. And so as MDMA takes effect and this previously improperly stored, highly fragmented, highly charged trauma material can emerge into consciousness, this material can finally go through and get organized as it should have been at the time of the trauma if the person wasn't in survival mode and worried about their safety. Rick Doblin and the Multidisciplinary Association of Psychedelic Studies, MAPS, has been responsible for generating all of the funding that's been needed to try to make MDMA Assisted Therapy an approved FDA treatment for post-traumatic stress disorder. This mission started back in 1986. And eventually MAPS PBC, MAPS Public Benefit Corporation, was the sponsor for the Phase 2 and the Phase 3 studies that were looking at MDMA assisted therapy for PTSD. In December of 2023, MAPS PBC submitted what was called the New Drug Application for MDMA Assisted Therapy to be considered for approval by the FDA. What was contained in this New Drug Application was all the safety and efficacy data from the Phase 1, Phase 2, and Phase 3 studies. In January of 2024, MAPS PBC changed their name to Lykos Therapeutics. And shortly after that, Lykos learned from the FDA that it was granting priority review status for their new drug application for MDMA assisted therapy. What this means is that the FDA is going to do a priority review and means that they will render a decision on approval no later than August 11th, 2024. So what are some of the next steps if MDMA is approved by the FDA in August of this year? The DEA has up to 90 days to decide on rescheduling, and they're going to be looking at Lykos's version of MDMA, which is going to be called midomethamphetamine, and they're going to be rescheduling that in the treatment of PTSD, and it is believed to probably going to be a Schedule 2 or a Schedule 3, which would mean it was still controlled, but it would be available by prescription by a physician. MDMA will still remain a Schedule 1 compound for now. The FDA has also been very clear that they don't rule on therapy. So all they're going to approve or rule on is the medication itself. And it's believed that they're going to give Lykos the ability to control the supply and the distribution, and to also determine what are the therapeutic components in MDMA assisted therapy, as well as the training components for therapists that are going to be producing MDMA assisted therapy. MDMA assisted therapy is currently about a 47-hour treatment protocol, and one of the things that they're going to have to do is they're going to have to figure out a way to be able to bring the cost down to make it affordable. For the Phase 2 and Phase 3 and expanded access studies, those treatment teams consisted of 2 licensed mental health professionals who had been specially trained by Lykos in MDMA assisted therapy. It's unclear what these treatment teams may look like post-approval, but one of the theories is that it will consist of 1 licensed therapist or clinician who has been specially trained in MDMA assisted therapy by Lykos. And then there may be a trained paraprofessional by Lykos Therapeutics who can join the therapist for the actual MDMA sessions. And this is all in a way to try to bring the cost down. Another issue we're going to have is training enough therapists. This is a specialized treatment protocol. None of us were trained how to do this in graduate school or medical school, and so it's going to require a time period where people are going to have to go through some specialized training in order to be qualified to do this type of work. Another issue we're going to have is insurance companies being willing to reimburse for this therapy. One of the things that I think Lykos is doing right now is that they're trying to present some statistics to these insurance carriers that are showing that even though the treatment may cost this much, it's going to save tremendous amount of money in the long term for these insurance carriers. So it's believed that in some time that insurance carriers will hopefully get on board and be willing to reimburse for this treatment. The Pearl Psychedelic Institute was one of 2 sites in the United States that was selected to participate in the FDA's Expanded Access or Compassionate Use program. Here at the Pearl, we are hopeful that we may be able to be a treatment site should FDA approve MDMA Assisted Therapy in August. Our hope is that we would be able to provide MDMA Assisted Therapy for patients suffering from PTSD. We would also like for the Pearl to be a training site where the therapists and the potential paraprofessionals who are going through their MDMA training, they require supervised practice in order to be certified to do this work. And so our hope is that the Pearl would be a site where some of these therapists who are in training can come, treat someone with MDMA assisted therapy under clinical supervision, and be able to earn their certification for MDMA assisted therapy so they can get out and begin to present this treatment to their patients. If you found this video helpful and you'd like to find more information on MDMA-assisted therapy, ketamine-assisted psychotherapy, and other information about psychedelics, please visit the Pearl's website at pearlpsychedelicinstitute.org or follow us on social media in order to keep up with our events and things that we have going on here at the Pearl. And also consider making a donation. It's tax deductible and it will help us to continue to provide these treatments at relatively low cost to patients and to allow us to continue to provide these community education pieces. Please consider liking this video and subscribing so that we can continue to provide you with more informational content.